Hello everyone, welcome to the M3 Academy. Yes, we are discussing some important tricks and tips to remember the CA cervix. Yes, this request put up by our premium members of the NEET PG membership for the cervix cancer mnemonics. Yes, so type of the CA cervix there are two types: squamous cell carcinoma and the adenocarcinoma. Yes, squamous is most common type. How you can remember when you write the cervix? C4 common, C4 squamous. Squamous, when you pronounce squamous ka means is like the C. So squamous is more common than adenocarcinoma. And among the squamous, there is a variety large cell non-keratinizing. Large cell non-keratinizing is most common subtype. Yes, so as the name suggests, large cell. So it is largely common. Yes, largely common. Then the subvariety is a small cell type has a poor prognosis. So you can say small cell has a small prognosis. Small prognosis means poor prognosis. Yes, most common HPV associated is 16. How we can remember cervix? You can write the spelling of the cervix Cervix. S4 you can remember 16. Yes, S4 you can remember 16. So HPV 16. Now, so second most common variety is adenocarcinoma. You can remember by a name of the girl Aditi, and Aditi is a young female. Aditi is using OCP, and age of the Aditi is 18 year, and Aditi is living inside the home means endocervix. Yes, so we remember this adenocarcinoma is the story of the Aditi. The age of the Aditi is 18 years, so you can remember HPV 18 using OCP. Aditi is young female and living inside the home means cervix. Yes. Now, so as we say cervix, C4 you can remember combined, and C4 you can remember common. So most common site is combined site means transitional zone, and most common age group is combined age group means there is a two age group 35 to 39 and 60 to 64 years. Now symptoms. So when you write the cervix CEBRIX, C4 you can say common symptom is I4 irregular bleeding. Yes, so C4 common, I4 irregular bleeding. So irregular bleeding is most common symptoms, but most specific symptom is post-coital bleeding, because we do coitus with a specific person. One specific person means a specific symptom is post-coital bleeding. And in alphabet, C and D is nearby alphabet, so you can say D for dirty vaginal discharge is also present. Pyometra is also present. So most common malignancy causing CA cervix. Most common malignancy causing pyometra is CA cervix. Yes, so what is the most common cause of the death in CA cervix? How we can remember CA cervix? When you write the spelling of the cervix, CERVIX. C4 common cause of the death. R for renal failure. Yes, so renal failure is most common cause of the death. Renal failure means you can say uremia. Yes, uremia is most common cause of the death. So how this is spread? As we know, the next alphabet to C is D, so you can say C goes to D for direct. So direct route, then you can say lymphatics and the blood. So when you write the blood is a double O D, L for lungs. Yes, so hematogenous spread means spread via blood is goes to the lungs. Now, so lymphatic drainage, the lymph node, you can just remember the mnemonic hope. Hope for hypogastric, obturator, paracervical, and external iliac. Yes, paracervical is sentinel lymph node. How we can remember? You can be senti in the pyar. Pyar means in English love. Yes, so senti in the love means pyar. Pyar means cervical lymph node, sentinel lymph node. Yes, so it does not drain in superficial lymph node. So cervix, as you write the cervix Cervix, S for superficial lymph node, X means not. So superficial cervical lymph node is not drained by cervix. Yes, so not included in radiotherapy. So not included in radiotherapy. Now, so prognostic marker, how we can remember? Just manipulate the spelling of the cervix Cervix. As for you can say staging, and when you write the prognostic, ST is common word. Yes, so cervix staging is prognostic. Then the lymph node diagnostic, you can say just write the C for cervix, B for biopsy, and D for diagnostic. Yes, so you can just write the alphabet B C D. So B for biopsy, C for cervix is diagnostic. Yes, the biopsy of the cervix is diagnostic. Now, ovarian involvement. So ovarian involvement is less than 1%. Ovarian O for 1%. O for you can write O for 1, O for ovarian, O for 1. So less than 1% ovary is involved, so you can say you will preserve ovary in hysterectomy, yes, to avoid premature menopause. Now best investigation for parametrium is MRI. So when you write the parametrium, it has a spelling MRNI. So parametrium itself includes the word MRI. So for parametrium we do MRI. For lymph node we do PET CT and then CT, yes, then CT. Now figure staging for cervical cancer. So in stage 1A and 1B, so 1A is less than 5 mm, 1B is more than 5 mm. So 1A and 1B, 1B you goes toward more deep, yes. So 1B is something bigger number, more than 5 mm deep, yes. Now second and third, how we can remember? Just difference of the word upper and lower, yes. So second upper 2/3 of the vagina, yes. The third is upper lower 1/3 of the vagina. Now so yes, so you can remember second A and second B. What is the difference? Just the difference of the parametrium. So second B means you can remember, yes. Second B before you can remember before, yes, before bid, yes. Just B before you can say bid parametrium, yes, with parametrium, yes, with in spite of with, you can say with parametrium, yes. So with with and bid is same pronouns, yes. There is a no term like the bid, but you can say uh, in spite of writing the with, you are writing the bid, yes. Now yes, yes. So B means with the parametrium, yes, parametrium involvement. Now the stage third is lower 1/3 of the vagina. Stage third is A, B and C. So A pelvic side is not involved, B pelvic side will involve plus hydroureter and hydronephrosis, yes. B means bid. So bid pelvic wall, bid hydronephrosis and hydroureter, yes. So now next is the third C. Third C is lymph node involvement. So you can remember by CL. CL means casual leave. So C comprises the lymph node involvement. C1 is pelvic lymph node. C2 is para-aortic lymph node. So how we can remember? Only single lymph node is single. So first, so it is included in C1. But para-aortic is two words. So you can say two word means included in C2. Now stage 4 is stage 4A and B. A for bladder and bowel involvement, regional metastasis. B is uh, B means Bahar. The distance metastasis means the distance metastasis of superficial inguinal lymph node, yes. Now management, so we can do surgery. The surgery indicated in first day or second stage. So just remember surgery, as for surgery, as for second. So up to 4 centimeter we can do surgery, preferred in early stage, yes, not preferred in 1B3. So radiotherapy, chemotherapy can be do in all stages. So you can say ready for the all stage, yes. Radiotherapy is ready to welcome up to the all stage, yes. So you can also do where surgery is contraindicated and which chemotherapeutic agent we use. C for cervix, C for cisplatin, yes. Cisplatin more than 5-fluorouracil we are using. Now next is brachytherapy. When you write the spelling of the brachytherapy, you can write IR for iridium 192, yes, brachytherapy. And you can remember the brachytherapy given after teletherapy. So B means badme means the Hindi word denote the after. So after the teletherapy we are using this. Then after the teletherapy, and B for beneath the body. So radiation source is beneath the body. So you can say brachytherapy B and R. So B for beneath the body, R for radiation source. So radiation source, B for beneath the body, R for radiation source. So radiation source is inside the body or beneath the body. IR means iridium after teletherapy. Yes, so there is a 2 point A and B. So point A is from external os 2 centimeter above and 2 centimeter lateral, and the point B is from point A is 3 centimeter lateral. So you can say as a point B means some bigger number, means some bigger number than the A, means more than 2. So 3 centimeter lateral to point A, and it not the obturator node. So we can remember B, the alphabet B also in the obturator. So point B toward the obturator lymph node, yes. Point B toward the obturator lymph node, yes. Point A for the parametrial lymph nodes. So how we can remember parametrium? When you see the spelling of the parametrium, it has a, it has a, it has a. So parametrium is a. Yes, obturator, there is a no a, there is no b in the spelling of the parametrium. So parametrium included in a, not the b, but in obturator there is a spelling b, there is alphabet b, so it denote the point b. Now teletherapy. So teletherapy, just you can do opposite of the brachytherapy, radiation source outside the body. Yes, delivered via external beam radiotherapy, EBRT, T44. You can remember isotype is cesium. Yes, given first to sink the tumor, and standard dose is 50 GSGY, total 2 GY into 5 session per week. Yes, so in this way we can remember some important concept about the some important forgettable data about the CA cervix. Yes, you can give your feedback to in the comment section or on the WhatsApp. And if you found any topic difficult, forgettable, and frequently mistaken in your GTs or your Q bank or your notes, you can request us on the WhatsApp or on the Telegram. Yes, we will arrange the supervision mnemonics on that session. Yes, so thanks for the participation.